Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh and good day everyone. Let's begin our program today with Murfuqan Al-Fatiha. Alhamdulillah, ladies and gentlemen, welcome to our program. Ladies and gentlemen, welcome to our program today, embracing post-COVID-19 pandemic. And as we all know, on this week, actually early this week, SASMEC IUM already endorsed a new SOP regarding COVID-19 SOP for SASMEC and IUM. And due to that, we are going to organize, organizing CME to enlighten regarding the SOP that we actually endorse, and that so that all the teams in SASMEC could take attention and also can practice for our services. Without further ado, I would like to introduce our first speaker, which is Assistant Prof. Dr. Edri Muhammad Aidit. Dr. Edri adalah pakar kesihatan awam dan juga pakar clinical epidemiologist daripada Kuliah of Medicine, dan kita berbesar hati Dr. Edri bersama kita di SASMEC semenjak awal tahun ini dalam merangka kita punya SOP yang baru di SASMEC. Selain daripada itu, tajuk yang Dr. Edri akan bincangkan adalah mengenai updates on COVID-19 epidemiology. Okay. Dan speaker kita yang kedua adalah Assistant Prof. Dr. Muhammad Abdul Shakur Abu Hassan. Tidak asing lagi, Ketua Jabatan Kecemasan SASMEC dan juga mengepalai EDCC, Emergency Disaster Coordination Center SASMEC. Beliau akan menyampaikan tajuk letter SASMEC COVID-19 SOP. Dan yang ketiga, kita ada Assistant Prof. Dr. Nur Hidayah Kamaluddin yang akan menerangkan lagi mengenai post-pandemic era PPE enforcement. Baik, tanpa membuang masa, saya ingin menjemput Dr. Edri untuk menyampaikan talk kita yang pertama. Alhamdulillah.
Okay. Bismillahirrahmanirrahim. Assalamualaikum. Boleh dengar? Can you all hear me?
Jelas, Doktor?
Boleh ya? Okay, right. Okay, saya share dulu my screen. Okay, can I confirm that you can see my screen now?
Yes,
boleh.
Boleh. Cuma Doktor boleh okay, yes.
Dah.
Screen.
Okay.
Yeah.
Alright. Okay. Okay, Assalamualaikum again, and a very good morning to everyone. So today I'll be touching on current updates, on COVID-19 epidemiology. Okay, first and foremost, okay, mungkin ada yang bertanya apa itu epidemiology. Okay, ini adalah satu field dalam kesihatan awam, okay, public health. So basically, what is epidemiology? We look at distribution of diseases, okay. Sebagai contoh, in this case COVID-19, di mana ia berlaku, siapa yang terlibat dalam kes-kes, berapa umur, okay, apakah faktor risiko dan sebagainya. Alright. Why is very important to look at this? Because it relates to prevention and control. Okay, at the end of the day, kita nak elakkan daripada tercetusnya kluster, tercetusnya kes-kes yang perlu dimasukkan ke ICU dan sebagainya. Okay, so this discipline is very much important, especially dalam public health emergencies. Okay, first and foremost, kita kena tahu dulu apa yang terjadi dalam COVID-19. We are in this COVID-19, I think, for the past 3 years. Okay, starting off dengan new evidence of a new virus. Masa tu semua orang panik di Wuhan. I think you all can remember. ada kes-kes datang ke hospital dengan masalah pernafasan, right? People don't know what is COVID-19 at that point of time. They call it as novel coronavirus, as coined by WHO. Selepas itu, selepas dia dah tercetusnya satu wabak di seluruh dunia, dia dipanggil pandemic. Okay, now we are already in the phase of post-pandemic. I will touch this later. But to let all of the audience know the importance of knowing this term, incubation period. Okay, tempoh penggeraman. Maksudnya daripada seseorang itu dapat virus itu COVID-19 daripada seseorang yang positif sampai dia ada simptom ataupun tanda-tanda gejala seperti demam, batuk, sesama, masalah bernafas, alright? So tempo tu very much important. Dulu kita ada a lot of variants in initial phase, kita ada alpha, beta dan juga other variants. Dia punya tempo inkubasi ataupun incubation period dia adalah panjang. Maksudnya simptom tu lambat timbul, okay? Simptom tu dia lambat timbul. But for the current variant, kita ada Delta, okay? Predominantly Delta in the early phase of 2021, okay? More severe, tapi dia punya incubation period dalam 4 hari, okay? Selepas orang tu berjangkit, dalam masa 4 hari dia akan timbul tanda gejala, alright? 4 hari lah, 4 hingga 5 hari. Tapi sekarang ni predominant adalah Omicron. I think you all have heard dalam news and also in the reports. Omicron ni adalah dia sangat cepat, sangat mudah berjangkit, alright? Mengikut satu kajian meta-analisis, they found out that tempo untuk dia berjangkit dalam masa 3 hari. Maksudnya dalam masa 3 hari dia kontak rapat dengan seseorang yang positif, dia boleh terus ada sakit tekak dan sebagainya. Maksudnya bila dia lagi pendek, jadi dia lagi cepat merebak, alright? However, it can be longer. Di tempoh penggeraman ni boleh jadi lagi panjang dalam kanak-kanak, elderly and also severe illness. Okay, and most infectious, a person ataupun individu tu lagi senang untuk menjangkiti orang lain semasa beliau ada tanda-tanda gejala. Okay, itu sebab kita nak enforcekan SOP. Kalau you all ada tanda gejala, please wear proper PPE. Please especially wear proper masking. Okay, so because of that, okay, because Omicron sekarang ni predominantly Omicron dan juga a few other variants, World Health Organization, Pertubuhan Kesihatan Dunia, masih lagi continue status PHEIC, kita panggil Public Health Emergency of International Concern. Okay, kenapa ini penting? Sebab apa? Bila WHO ni dia tekankan is in the state of PHEIC ni, walaupun kita dalam so-called post-COVID pandemic, tapi this status will allow countries yang mana kes masih banyak, kita akan try to supply them with vaccination, PPE. Maksudnya bantuan tu akan berterusan, dan kita especially in Malaysia, kita kena still sentiasa berwaspada, bersiap sedia atas segala kemungkinan. So itu sebab WHO masih lagi kekalkan, sebab ada setengah country masih lagi ada masalah dengan COVID-19. Okay, jadi if you look at the current situation now, starting daripada start pandemik hari tu 2020 sampai sekarang, dia punya persoalan ataupun virus tu dia adapt. Okay, starting daripada first one, macam saya kata tadi, virus yang baru, tak ramai yang tahu, sampaikan kita terpaksa melakukan di negara kita terpaksa melakukan PKP, alright, MCO, Movement Control Order. Movement Control Order is part of non-pharmaceutical intervention. Maksudnya, kita sekat pergerakan supaya perebakan tu terkawal. Okay? Yang tu pada permulaan 2020. Sampai 2021, masa Delta muncul, Jadi kita dah start membuat mass vaccination, our national vaccination program for PPV for COVID-19. Kenapa very important vaccination is because vaccination telah terbukti mengurangkan keterokan severity of COVID-19, okay, dan memendekkan tempoh keberjangkitan kepada orang lain. So they're very much important. Okay. So that until the end of January 2022, di mana Omicron mula memuncul dan merebak secara cepat. Okay, but now, where are we now? Okay, di manakah kita sekarang ni? Okay. Kalau kita tengok kita punya trend worldwide, most of the countries are in the phase of deceleration and also preparation. Okay, preparation apa? Preparation untuk pandemic preparedness. Pada mulanya kita respon kepada apa-apa masalah berkaitan COVID. Sekarang kita more to prepare, kita bersedia atas sebarang kemungkinan. Okay, looking at the trend of the cases now, we can see that the cases around the world fluctuating, but I think we are starting to look at the decreasing in the number of cases, especially in Japan, UK, United States, Malaysia, and also India. Here, I just give example here. If you can see here, as example in Japan, they are starting to relax their SOPs. Okay, di mana even dekat public, dia dah mula untuk relaxkan masking. Okay, dekat tempat public, maksudnya kalau tempat crowding, okay, you are advised to wear mask. Tapi if not, then no need. Okay, a lot of countries are doing it now. Okay, why is because if you look at the number of the cases currently, we have cases reported and also under-reporting of cases, but we are seeing less and less death due to COVID-19. Okay, however, looking at the current scenario, kita sekarang ni sebenarnya kalau tengok situasi masalah kesihatan, kita ada communicable disease and non-communicable disease. Masalah penyakit berjangkit dan penyakit tak berjangkit. Penyakit tak berjangkit sekarang ni adalah predominant, okay, iaitu kita nampak banyak pesakit dimasukkan ke hospital disebabkan kecemasan manis, darah tinggi tak terkawal, okay, stroke dan sebagainya. Okay, so these are actually risk factor. Ni adalah masalah penyakit tidak berjangkit ni, NCD ni adalah faktor risiko kepada COVID-19 yang severe. Okay? Sebab tu kita masih lagi kena dalam fasa berjaga-jaga, kita tak boleh remove SOP itu totally. Okay, looking at the current trend, in Malaysia, most of the rates here are showing decreasing in trend. Number of death, bilangan kematian, ventilated, admission to ICU, admission to hospital, confirmed cases, dan juga test conducted. Sekarang ni bilangan test pun makin berkurang, alright. I think especially in public, alright. They know how to self quarantine. Kita dah empower public untuk quarantine kendiri, okay, dan report sendiri ke MySejahtera. Bilangan positif pun makin berkurang. Dulu, I still remember during Omicron, is more than 10% positive rate, 11%, 15%. Sekarang ni, daripada bilangan jumlah test yang telah dijalankan, hanya 1.6% positif. Alright. Okay, why is very important to look at COVID-19 as a whole? Maksudnya, kita sekarang ni, okay, sebagai member Susmed IUM, sebagai contoh, kita berada di hospital. Alright, kita berada di hospital. Kita ada healthcare worker, staff dan juga patient. Tapi we need to remember that once we discharge the patient, we discharge the patient outside, kita discharge pesakit ke rumah masing-masing, mereka ada kaum keluarga, family member. Alright. So jika kita tidak manage properly, kita tak inform pejabat kesihatan, kita risau perebakan tu akan cepat. Okay, so whatever it is, this cycle must be kept as strong as possible. Maksudnya hospital dan PKD perlu bekerjasama sebaik mungkin untuk kita control and maintain COVID-19 di tahap yang terbaik buat masa ni. Okey. Sekarang ni kita tengok sikit data di Malaysia. Okay, this is data published in 2020 during the first phase of the COVID-19. Majority of the infection sebenarnya datang daripada community, alright? Maksudnya kalau kita lihat dari segi hospital, infection datang daripada community. Okay, so jika staff yang bekerja di hospital, dia ada risiko untuk merebak daripada staff yang datang daripada community itu, daripada rumah ke staff lain dan juga ke patient lain juga. Alright. So ini adalah sumber-sumber yang risiko untuk mendapat jangkitan di dalam hospital, dan juga cara untuk kita cegah tu ada banyak cara. Okay, saya akan terangkan kemudian. Okay. Yang tu data Malaysia. How about our current suspect IIUM data? Okay, I have managed to analyse dan juga tengok trend tahun 2022 daripada Januari sampai hujung tahun. Okay, graf ni menunjukkan confirmed case of COVID-19 by department. If you look at the trend untuk 2022 adalah lebih kurang sama macam Malaysia, dan lebih kurang sama macam most of the countries di dalam dunia. Okay, di mana early phase of COVID ni, okay, early phase of COVID, you can see it peak in the number of cases during the early phase of Omicron. Okay, kalau kita tengok dari segi department, kebanyakan kes datang daripada datang dan juga reported daripada kecemasan ED, dan juga medical. This is not surprising, okay, because they will be admitted to SARI ward and also dan sebagainya, okay, di medical. Dan this trend is continuously evolving throughout the department. Okay, this is to show you that COVID-19 affects all of the departments, not exclusive to one. Alright, so that's why semua kena memainkan peranan, okay, untuk kita jaga, kita jaga kita lah basically. Alright, so kalau you ada staff yang ada simptom, cepat-cepat nasihat, okay, untuk memakai mask, proper PPE dan sebagainya. Okay, is a social responsibility for everyone. Okay, dari segi kategori COVID-1, Cat 1 tiada simptom, kategori 1 tiada simptom, kategori 2 dan ke atas ada gejala. Okay, di mana kategori 3 ada tanda-tanda jangkitan di paru-paru dan juga ke atas lah, 5 adalah severe, perlu bantuan pernafasan. Kita tengok the number of cases kebanyakannya datang daripada kategori 2, mild symptoms, gejala yang ringan. Okay. 2022 memang predominantly kalau tengok data genomik pun memang datang daripada Omicron. Alright, tidak banyak datang daripada kategori lain. Tapi bila kita tengok dekat sini, kalau dari segi jangka masa dekat sini, kadar purata average untuk tiada gejala, cases datang dalam bulan 4, dan gejala dan juga yang bergejala datang, bergejala serius datang pada early March, dalam bulan March, dalam purata. Gejala ringan datang lewat. So basically evolution of the COVID-19, the longer the duration, okay, the longer duration of the COVID-19 evolution, the less severe the COVID-19 distribution we can see. Okay, so sekarang ni kebanyakan kes adalah kes gejala yang ringan, kategori 2 dan juga tiada gejala untuk setengah pihak. Okay, dari segi risiko, risiko untuk dapat gejala yang teruk, kategori 3 hingga 5. Data ini adalah data yang limited, okay, yang kita collect daripada EDCC, okay, Emergency Disaster Crisis Center. Kita dapati bahawa kebanyakan yang mendapat gejala kategori COVID yang 3 ke atas, mostly datang daripada elderly, warga emas. Okay. 68 kali ganda, okay, lagi berisiko untuk dapat gejala yang teruk berbanding dengan kanak-kanak. Alright. Dan juga dari segi patient, okay, patient yang masuk 12 kali ganda lagi berisiko untuk dapat gejala yang teruk berbanding dengan staff. Alright. Apakah implikasi-implikasi daripada data ni? Ini menunjukkan bahawa kita kena jaga our vulnerable population, elderly. Okay. Elderly. Jadi kita sendiri kita sebagai staff ataupun masyarakat yang masih lagi sihat, kita paling penting untuk kita jaga SOP dan juga langkah-langkah lain untuk kita cegah daripada penjangkitan is because we want to protect the vulnerable group, elderly especially. Okay, lagi berisiko. So kita kena pakai mask betul-betul, vaksin dengan mengikut indikasi dan sebagainya. Alright. Dan juga patient higher risk to get severe COVID as compared to staff. Alright, because staff by principle, okay, especially healthcare worker, kita ada PPE, kita ada SOP untuk PPE in place. Okay, I think later Dr. Hidayah and Dr. Shakur akan explain further. Very much the effect of PPE is very much important untuk kita cegah daripada mendapat kes-kes COVID yang teruk. Okay, so ini adalah maksud daripada table ni. So again, what we can learn, ini adalah slide yang saya yang terakhir. What we can learn from COVID-19 post-pandemic so far. Okay, kita boleh belajar bahawa kita perlu berubah mengikut masa. Embrace the change. Alright, embrace the change. Perubahan pada SOP telah dirangka bukan sekadar atas kertas. Dia dirangka atas kajian saintifik, atas evolusi ataupun atas perubahan dari segi kuman tu sendiri. Alright. So kita kena aim, whatever we do, kita kena aim daripada kita merawat untuk kita cegah. Okay, cegah lebih baik daripada merawat. Okay. Figure ni, gambar ni just menunjukkan satu modeling, satu study menunjukkan bahawa kalau kita jaga kita punya SOP, kita boleh kurangkan keberjangkitan COVID ni dan kita boleh kurangkan kos. Kita akan jimatkan kos untuk kemasukan dan juga pengurusan hospital. Of course, apa-apa yang kita buat selepas ni, selepas apa-apa SOP ataupun apa-apa langkah, kita perlu spread the message. Alright, spread the message and inform. Okay, sesiapa yang tidak hadir, inform balik kepentingan untuk PPE, kepentingan untuk vaksinasi. Alright. And also untuk menjaga. Kenapa kita yang sihat perlu menjaga? Sebab kita nak melindungi orang yang lagi berisiko. Contohnya warga emas. Alright. So I think that's all from me. Saya pass over to the MC, Dr. Fadi. Thank you.
Jazakumullah khairan kepada Dr. Adri. Alhamdulillah, Masya Allah. Tak sangka data kami yang daripada EDTC, daripada CMU Kelab dipersembahkan dengan begitu baguslah. Senang untuk di-appreciate dan difahami oleh kita lah. Okey, tanpa membuang masa, saya ingin menjemput kita punya presenter yang speaker kita yang kedua, Assistant Prof Dr. Muhammad Abdul Shakur, menyampaikan the latest SOP SASMAC COVID-19. Tafadhal mashkura Dr.
Yeah, Assalamualaikum. Thank you, Fadi.
Assalamualaikum.
So, let me share my screen first. Okay, Assalamualaikum warahmatullahi wabarakatuh to everyone who attend this hospital CME today. So I'm glad to share with all of you our latest SASMAC IM COVID-19 SOP as already presented by Dr. Adri. So we are now actually embracing the COVID. I think most of you already embracing it during your daily lifestyle outside and also in the hospital. But in the hospital, we need to have a proper SOP so that everyone is clear and how are we going to embrace this COVID-19. All right. So without further ado, I'm just going to present the presentation first. And first of all, so these are the contents which we will go later. Okay, it's not much actually, more on SOPs, the flow. And then at the end of the slide, there are a few slides on frequently asked questions within this 1 week, since we started early this week. So within these few days, we already received a few questions. So I just brought up here in this presentation so that we all can understand. And then the Q&A session will be at the end of the Dr. Hidayah, after Dr. Hidayah presentation later. Okay. Right. So if you have question, just write it down first, and then we will discuss after the third presenter have presented the presentation. Okay. So the first one is the flowchart for staff SASMAC. Okay, with positive COVID. Okay, this is for staff who become positive. I think this is quite clear. So if the staff positive, either by PCR or by self-test or by RT swab, okay, what they need to do first is to inform their supervisor, immediate supervisor, for nurses, inform their sisters, for sisters, inform their matron, and so on. Okay, for MOs, inform their specialists. Okay, and then fill up a Google form for positive and close contact staff, and then again update MySejahtera as usual for quarantine, because there is no more quarantine leave. All the quarantine leave will be by MySejahtera. Okay. However, for medical staff, there's a loophole where at day 4, okay, we can be reassessed, and if RTK formal swab is a negative, they can return to work, right? So for staff who is positive, at day 4, they are advised to go to a clinic warga SASMAC, okay, and do a formal RTK swab. And then if negative, they will be allowed to work. And if they are positive, they are to complete their quarantine as per MySejahtera and no need to repeat RTK, right? Until day 7, okay. However, because our clinic warga is only on weekdays, if the day 4 is on the weekend or public holiday, the staff can continue to complete their quarantine as per MySejahtera. Okay. Or if they need it, they can go to any nearby clinic which are open to get a formal RTK swab to allow them to come back to hospital, right? To return to work. Okay. That will be depend on the supervisor, depending on the manpower at their department. Okay. Now the second is the flow chart for close contact of healthcare worker in SASMAC. Okay. So for staff, okay, who has close contact, of course, the first one is to inform their supervisor. Okay. And then fill up the close contact online Google form. Okay. And then depending on the weekend or weekdays, okay, if on weekdays, they need to attend the clinic warga SASMAC during the office hour. Okay. And then they will be doing RTK formal swab on day 1. And they will schedule for day 3 for swab, and the MC will be given. Again, there is no more quarantine leave for close contact. Yeah? So only MC will be used for close contact. And then if they are negative, they are allowed to return to work. However, if they are positive, they are going to treat as positive as per usual. And then for the weekend, the public holiday, so the RTK self-test, I think we allow the time for the doa first.
Yes, Doctor. Can.
All right, we continue. Okay. So if the healthcare worker had close contact during weekend or public holiday, they can do self-test at day 1 and day 3. And if positive, of course, flow the positive chart. And then if they're negative, they can attend to work after day 3. But they need to also attend clinic warga SASMAC during the office hour for their MCs. Okay. Because if not, they will be considered as absent without leave. All right. And this RTK self-test must be put in dates and also the ID of the staff. Okay. For asymptomatic close contact, you don't need to do a test, and you can work as usual. So this is the close contact definition. Only a direct contact with COVID-19 positive case. Either face-to-face more than 15 minutes with a less than 1 meter distance without wearing a mask. So in the hospital, if you're wearing a mask, you should not be close contact, yeah? Or you had a physical contact with the positive patient. And then these are the symptoms, okay? So I think all of you aware of it by now. If you have fever and cough, both of these is considered symptomatic. And if you are having 2 or more of these symptoms, can also be considered as symptomatic, right? But if you only have 1, sore throat only, might not yet considered as symptomatic. Okay. Okay. Now number 3 is flowchart admission from emergency department and urgent admission from clinic to ward. So previously, all patients from clinic or emergency department need to be swabbed. Now we already changed it to only targeted groups. Okay, so patient who presented to emergency department or clinic, if they are planned for admission or urgent admission, okay, from clinic, we will screen them whether they are symptomatic or they are in the targeted group. Okay, if they are not symptomatic or not in the targeted group, so we don't need the RTK for admission anymore. Okay, they can admit using the general pathway. Okay, so they don't need to go to the lower ground level. So, however, if they are symptomatic or they are part of a targeted group, so they need to do the RTK formal swab at ED, or if from clinic, they can do a formal swab at the swab booth. All right. Okay. And if positive, of course, if positive and require admission, of course, they will need to admit via COVID-19 pathway. And this targeted group, number 1 is the one who are having SARI symptoms. Okay. And then non-SARI patient requiring supplemental oxygen, and also special groups who have high risk of progression or will benefit from early antiviral if they have COVID-19 like symptoms. Okay, the example is the immunocompromised patient, end-stage renal failure, and also ONG patient admit for delivery. Okay, this is the COVID-19 pathway. All right. So this one, I think all of you are familiar already. If positive, you refer to the COVID-19. If positive, the team who took the swab need to notify, and then the need to refer the specialist COVID for admission or our ID or now medical. So and then if patient ready to admit, then you inform the security to use the leave number 9. I think this is similar. Okay. Sorry. Okay. In the event that the primary team require a swab for the patient who do not fall under the above mentioned group, the primary team may admit the patient into the isolation room and take the swab in the wards. Meaning that if the patient is actually not in the targeted group, not in they don't have respiratory symptoms. However, the primary team requires swab, so they can still do it in the ward by admitting first to the isolation room. okay, or a cohort area in the ward, and do the swab in the ward. Okay, now is the flow chart elective admission for operation or aerosol generating daycare procedure. Okay. Okay, so usually this is elective admission from clinic, schedule from ward or even from daycare. So set date for admission and procedure, and then of course book for swab via Google Form. We have a link for booking swab, and then they will be proceed with swab in our swab booth. Okay, so proceed with RTK swab 48 hours prior to plan admission and procedure at swab booth. Okay. And then the result should be traced by the primary team. If positive, to notify the KD, primary team to inform patient and determine the urgency of admission. For urgent admission, admit via COVID pathway. If not urgent, to reschedule. Okay, and for intermediate, for urgent admission, admit via COVID pathway. For COVID-19, PCR in ward. If not urgent, to reschedule. And if negative, inform patient and procedure for admission. This is actually about the same as previous. Okay, however, we just change it to aerosol generating or operation. Okay, for non-aerosol generating procedure, if patient symptomatic or are in target group, may proceed for RTK swab RTK swab in the swab booth. Okay, again, it's the same targeted group. So let's say if you see a patient, you want to schedule a patient for operation, they are not doing a procedure, operation, non-AGP procedure. So however you feel like they are in the targeted group, you can still request for swab in the swab booth. Okay. Okay, these are the procedures that involving endoscopy, which require RTK and which are not required RTK. This is actually agreed by our respiratory specialist and also our surgical coordinator, daycare coordinator. So the endoscopy procedure that need to do RTK is anything related to OGDS, okay, anything related to colonoscopy, ERCP, EUS, okay, bronchoscopy, thoracoscopy, rigid bronchoscopy, esophageal manometry, and also pH study. Okay, for endoscopy procedure that don't require RTK is a cystoscopy examination, okay, RPG stenting, urodynamic study, ESWL, anal ultrasound, anal manometry, biofeedback, pleural tapping, okay, and also ultrasound thorax, okay, with biopsy sampling. So this one no need for RTK. Okay, both link for elective swab, okay, elective swab booking, and also healthcare worker positive or close contact already in the EHR, okay. So you look at the personal tab. So you can book for elective swab here, all right? And then you can also declare if you are close contact or positive here, okay? Now, a flowchart for accepting referrals from external hospital, okay? So for referral from external hospital, from private or public, we are actually maintaining the same, which is we require RTK or PCR swab within 48 hours from time of transfer. Okay, this one is from our discussion during our meeting in EDCC. Because we are not sure whether they have close contact or whether they have been screening prior to that. So we are not, there's a lot of factors that we are not considering from their admission in that hospital. So that's why to be safe, we require RTK or PCR prior to their transfer. Okay. So if they're negative, they can transfer. If positive, we still maintaining that we are not accepting any positive cases. Okay. Then when they are transfer, staff from the center can transfer toward via lobby hospital level 2, which is the same as previous prior to our COVID. Okay. However, for IMSC, because IMSC is considered as our extension, okay, part of SASMAC, so the COVID-19 RTK antigen and RT-PCR valid if done within the same emission. If they have done during the emission, no matter how many hours, okay, they are considered valid. Okay. And then the COVID-19 as for RTK swab and also PCR swab is still valid for 48 hours if patient had been discharged. Okay. So if they went back home within 48 hours, they come back, they still considered valid. And then if they are positive from IMSC, we accept from IMSC, they will be using the COVID-19 pathway. For ICU referral, if patient is not stable, of course, need to inform emergency specialist and send the patient to emergency first. Okay, if patient is stable, they can be direct admit. Okay, and the MO staff nurse ICU will stand by at the entrance next to emergency department and PSC and escort into the ICU. Okay. For flowchart for patient close contact in ward, okay, patient in ward which have close contact with positive case. Let's say suddenly they said, oh, my mother is positive, or the next patient is positive. So you need to consider whether need to isolate this patient, okay, and you need to isolate this patient and then do RTK swab. Okay, step. If negative, then depending on the primary team, to decide whether they need for PCR or not. Okay, because already negative. If they don't think they need for PCR, they can just allow transfer back to the open bed and transfer out from isolation room. If they think the RTK is negative, but they consider as this patient doesn't look like a negative, maybe they have symptoms or they have fever or anything that make them feel that it require PCR. Okay, so you still need to proceed for PCR first before you transfer out. Okay, if negative, then you can transfer out. If positive, you can complete quarantine as per MySejahtera. Decision for isolation at ward or discharge to complete quarantine at home as per primary team. Meaning here is that if they are positive, okay, and they are stable enough to be discharged, right? So you can allow them to be discharged and continue quarantine at home, or you can allow them to complete their quarantine in the ward depending on the patient condition. Okay. So if you want to discharge at home, you have to make sure they are able to quarantine themselves. They have support to help them to be isolated at home, be quarantined at home. Okay. So indication for RT-PCR here, we put here symptomatic, household, close contact, and exposure within 5 days. Okay. So and also if you want to ask, you may ask our covering ID physician, right? Okay, for caretakers, now it's more clear. For caretakers, you don't need to do COVID-19 self-test anymore. So everyone can be a caretaker. But the criteria we want to strict is that make sure they are asymptomatic and they are adult enough to take care of a patient, which is more than 18 years old. If they are symptomatic, the staff in the ward can ask them to return to home and find a replacement. Okay. For examiners and students, Okay, this is because we are teaching hospital, so we will involve with exam and students. So for COVID-19 saliva test, screening if symptomatic only. All right. So if they come for exam, the student come for exam or the examiner come for exam, if they are symptomatic, they need to do self-test. And if positive, they need to quarantine as per Masyatra, and if negative, they may allow to enter with a proper PPE. Because they are symptomatic, they need to wear a proper PPE to be involved with the exam. All right. Okay, these are a few frequently asked questions this 1 week, mostly related to staff positive. So in case 1, staff A positive self-test on Monday morning, okay, due to symptomatic, what should he or her do? She do. So he should inform his supervisor as soon as possible, fill up the Google form we shared earlier, update MySejahtera for quarantine, and then on day 4, which is Thursday, because this is Monday, he should come to Klinik Warga Susmed during office hour for assessment and formal RTK swab. If the RTK negative, they may allow return to work. If RTK positive, they can complete. If RTK positive, they need to complete quarantine as per Masyatra, okay, for 7 days. Okay. So RTK usually take about 1 to 2 hours only. Yeah. So if you come in the morning and you're working PM shift, so it's better to come earlier in the morning. Okay. For case 2, staff B positive self-test on Wednesday night due to symptomatic, what should he do? Okay. So she should inform her supervisor as soon as possible. Okay. Fill up Google form, update MySejahtera for quarantine order. Okay. Complete quarantine as per Masyatra. And because the day 4 is fall on Saturday during weekend, or it fall on public holiday, they don't need to repeat RTK, they just continue to complete the 7 days. Okay. But if they want to work, it's okay, they can go to any nearby clinic. For this case number 2, they go to any nearby GP clinic and get a formal negative result, and then they may allow to return to work. Okay, for case 3, on Thursday evening, staff C is a close contact with his wife, positive. Okay, this is close contact now. Okay, he's having symptoms. So symptomatic healthcare worker with close contact. So he should inform his supervisor as soon as possible, fill up the Google form, attend the Klinik Warga Susmed during office hour for assessment and formal RTK swab. Stat and also on day 3. Okay. Allow return to work if swab RTK on both day 1 and day 3 negative. And then they will be given MC for day 3 until day 3. If positive, of course, follow the positive flow. On Saturday morning, for case 4, on Saturday morning, staff D is a close contact with her mother. She's having symptom cough and sore throat. Okay. She should inform her supervisor as soon as possible, fill up Google form, do RTK self-test because it's already in weekend, do stat RTK self-test on day 1 and day 3. Attend Klinik Warga Susmed during office hour as soon as possible for MC, and allow return to work if RTK on both day 1 and day 3 negative. Okay, if positive, follow flow chart positive. Okay, in case 5, okay, patient E came to ED in view of left DFU. This is an example with OM. He was admitted for IV antibiotic and dressing, but not keen for amputation. So he admitted to ward without RTK because he was asymptomatic and do not fall in any targeted group. However, after 3 days in ward, he agreed for amputation. This operation is planned by primary team to do in emergency OT. What should the primary team do? So for this patient, you can isolate or cohort this patient and do a formal RTK swab in the ward, and then can proceed as usual. If negative, if positive, may complete quarantine as per patient Masyatra, and then primary team to decide whether need to proceed or postpone the operation. If need to proceed and the patient is positive, they can do the operation in COVID OT. Case scenario 7, patient F come for appointment at SOPD clinic. After seen by a medical officer, the MO decide to admit her to ward for IV antibiotic only. No plan for emergency operation. She is asymptomatic and not in target group. Does she need to be swabbed before admission? So for this kind of patient, no need to swab at swab booth. May proceed for direct admission from clinic to ward. However, let's say after 2 days in ward, primary team decide for emergency operation, so then they need to isolate a cohort patient and do swab, RTP swab. Okay. In case 7, patient G at ETD seen by primary team, plan for laparotomy appendicectomy under emergency OT as soon as possible. Where and who should do RTP swab for this patient? Okay. So patient should be swabbed at emergency department by primary team, by primary team, and if the case is urgent, an operation should be done as soon as possible. Okay, if operation plan from emergency department is semi-urgent, primary team can do the swab at ward. Okay, if they are not in the target group or symptomatic. However, even though I mentioned this, the emergency, really emergency case, for example, polytrauma with ICB, that really need emergency operation. Usually for this kind of patient, emergency will already take the swab. Okay. All right, thank you. So I think if you have any question, we proceed after the session with Dr. Hidayah.
Alhamdulillah, Masya Allah, thank you Dr. Shakur for your presentation just now. Alright, without further ado, I would like to invite Assistant Prof Dr. Hidayah Kamaruddin to represent, menyampaikanlah kita punya tak berkenaan dengan PP enforcement. But before that, as you can see on the screen now, Dr. Hidayah will give some quiz for us to answer regarding infection control. Okay, without further ado, tafadhal mashkura, Dr. Hidayah.
Okay, Assalamualaikum warahmatullahi wabarakatuh. So welcome everyone. So I have two parts for my presentation. The first part will be the quiz. Basically quiz ni since kita dah bergelumang dengan COVID ni for almost dah masuk tahun ketiga ataupun dah lebih 3 tahun so Dr. expect we are at a certain level of practice and knowledge with regards to COVID-19 IPC. So Dr. nak take this opportunity to do this brief assessment. If we can get your cooperation to go to this website, joinmyquiz.com, and enter the game code. Okay, the faster we do this, the faster we settle. Just a simple question that I need you to give your input. Okay, the second part of my presentation would be the slides. So I don't have many slides, just only 10 slides. Basically on PPE lah mainly, and a little bit on input for healthcare worker, and a little bit for caretaker and also visitor. Okay, so we have over 300 participants are watching this CME. So I hope everyone can give your full cooperation. Okay, 16. Okay, lagi cepat kita, semua orang daftar ni, lagi cepat kita settle session dan kita boleh proceed to Q&A. Faster. 25. Okay, ada lagi ni baru 36. Jom join. 46. I'm sure among the audience ada doctors, ada MO, ada nurses, ada support staff, ada lab staff. Dr. encourage semua untuk masuk. Sebab IPC ni umum, dia apply dekat semua tempat. Ni 62. Dia bagi lagi 3 perusahaan. Cepat-cepat register. 67. 68. Oh, ada Siti Nurhaliza. (74) Ada lagi? (76) Okey. Doktor happy kalau kita dapat reach until 100. Ada lagi? 78, 79, 80, lagi sikit. Ada lagi? 1, 2, ada lagi. Okay, we are closing the registration in 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay, kita start Bismillahirrahmanirrahim. Okay, soalan pertama. Okay, listed and the following is of other component of level 1 PPE. 2 perusahaan je, 3 perusahaan. Jawab laju-laju. Ini sebelah mata je ni boleh jawab ni. Okay, 5 saat lagi. 3, 2, 1. Time's up. Okay. Okay, level 1 PPE, okay, semua dapat. Basically, kita punya level 1 PPE adalah semua yang terlisted ni. Cuma, during post-pandemic era, kita pay less attention to pemakaian of face shield. Nanti kita pergi balik, dekat slide akan emphasize balik this point. Okay, next question. Okay. Component of level 2 droplet PPE. 3 perusahaan. Laju jawab ni. Level 2 droplet. 5 saat lagi. Okay, time's up. Ada yang jawab N95 mask level 2 droplet Level 2 droplet dia punya PPE adalah surgical face mask. Nanti yang angkat tangan nak tanya soalan ni nanti kita attend during Q&A. So surgical face mask, long sleeve gown, glove is the component of level 2 droplet PPE. N95 mask is not part of droplet PPE level 2. Okay, so bagus ni revision ni. Ada yang masih lagi confused and tak properly aware. Next question. Yang ni soalan yang ni. Component of level 2 airborne PPE. Jawab laju-laju. 10 saat lagi. Lima saat. Faster, faster. Time's up. Okay, so level 2 airborne. Semua betul. Okay, N95, long sleeve gown, face shield and glove. Okay, then next question. Okay, which is the correct 5 moments of hand hygiene? Kita ada 5 moment of hand hygiene. Yang mana yang betul? This one you boleh jawab multiple answer ni. Beberapa jawapan boleh bagi. Sekejap je. Ni laju-laju je ni macam OSP. Ada yang menjawab ni. Before touching the patient's bed rail, is not one of the moment. If after you touch the patient bed rail, then it is being a moment of hand hygiene. Before inserting CBD is equal to before doing a clean or aseptic procedure. After contact with patient blood is equal to after risk of exposure to body fluid. After perform physical examination, this one after touching patient. Okay, so masih ada lagi yang mungkin tak berapa jelas ataupun terlepas pandang, mungkin masa sekejap sangat nak jawab soalannya, tapi tak apa. Alright, next one. Okay, so kena maintain safe 1 meter distance between yourself and a colleague. Yang ada sakit tekak, batuk dan sesama. Masih relevan tak statement ni? Agree ke, disagree ke, tidak pasti. Nah, ini mudah je lah ya. Okay. Ada juga yang disagree. Macam mana? So distancing, walaupun kita tak enforce benda ni macam previous punya condition, walaupun di post pandemic era kita masih lagi kena berhati-hati. Jarak tu paling penting, because kita tahu COVID-19 can be transmitted melalui titisan udara dalam jarak 1 hingga ke 2 meter. So safe distance ni masih perlu ada. You should inculcate this one in yourself. Kita dah 3 tahun dah dengan COVID ni. So we really need you to do this. Unless yang ada simptom tu pakai mask. Maybe that one mungkin boleh ada discount lah sebab dia dah protected in a way. Okay. Alright, next question. Well ventilated area is important to prevent COVID-19 transmission. Harapnya semua faham what is well ventilated area means. Okay. So yang ni pun ada disagree. Okay, untuk nak prevent COVID-19 transmission, you need to be in a well ventilated area. Minimizekan masa you all berada di a closed confined space. A well ventilated area ni maksudnya ada angin masuk dan ada angin keluar dekat bilik ataupun di area berkenaan. So kalau dekat dalam bilik yang tertutup tapi pasang kipas, air tu dia berpusing, tapi it is not considered as a well ventilated area. Dia kena ada udara bersih masuk dan kena ada ruang di mana udara tersebut keluar. Itulah yang dimaksudkan dengan well ventilated area. So I hope everyone aware lah pasal ni. Okay, next. Next question. High touch surfaces should be cleaned regularly, at least 2 kali sehari, to prevent transmission of COVID-19 in the healthcare setting. High touch surfaces tu macam gagang telefon, dekat your workspace, dekat Swiss. Ini pun ada yang disagree juga. Okay. As you all know, COVID-19 ni dia boleh transmit bila titisan-titisan pernafasan tu dijatuh atas tempat-tempat yang selalu disentuh oleh sama ada staff ataupun public. So, bila surface ni tidak dibersihkan, dia boleh jadi tempat untuk transmit virus tu kepada orang lain yang sentuh jika kita tidak bersihkan tempat tu. So, regular cleaning is very important. Agree? does not mean that you all practice, but at least you should know the things that you should know, and hopefully you all dapat hidayah later on untuk buat benda ni during your day-to-day practice. Ya, Dr. doa benda tu semoga semua terbuka hati ya. Next question. I do comply to a good hand hygiene practice while delivering my service to the patient. Ini yang memerlukan kejujuran ya untuk menjawab soalan ni. I hope everybody is honest. Okay, time's up. Okay, majority agree tapi ada yang disagree. Alhamdulillah yang disagree ni jujur ya. So Dr. harap yang 66 agree ni memang betul-betul buatlah practice hand hygiene pada moments yang sepatutnya dan perform hand hygiene dengan cara yang betul. Next question. Sikit lagi. Following is or other option for placement of PUI or confirm COVID-19 patient in ward. Dekat mana nak letak patient PUI ataupun confirm COVID patient in ward? 4 pilihan jawapan, boleh jawab lebih daripada satu jawapan. Okay. For this one jawapan dia semua betul. Sorry, semua 3 betul dan 1 salah. You cannot put ada juga yang jawab 14 Okay, positive pressure isolation room ni tak boleh letak patient COVID dekat sini sebab kalau letak patient dekat dalam positive pressure room ni dia akan tolak virus particle tu keluar bilik. So orang dekat luar bilik pun boleh dapat jangkitan So boleh letak patient dekat negative pressure room, boleh letak patient dekat single well ventilated room ataupun even boleh cohort di open cubicle. Tapi dia punya turutan dia negative pressure room dulu, followed by single well ventilated room, followed by cohort dekat open cubicle. Okay, laju-laju ni. Next question. I do comply to standard universal precaution while delivering my service to the patient. Ini pun memerlukan kejujuran untuk jawab ya. Tiga saat. Okay. So Alhamdulillah 85 agree. Tapi ada juga satu, Dr. suka lah yang seorang ni dia jujur menjawab soalan. Tapi for your self-improvement, you should comply lah. This is the thing that is expected from us as a healthcare worker to practice at all time while we deliver service to the patient. Okay, because if you don't do so, you are delivering a substandard service to patient. Maksudnya mungkin khidmat kesihatan yang tidak berkualiti at par with the standard. So Dr. harap you all comply to the required standard of you to perform. Okay, next one. Following are the main mode of COVID-19 transmission from an infected patient. Cara COVID-19 tersebar macam mana? Ini pun boleh jawab beberapa jawapan daripada 4 pilihan tu. Ramai tak jawab ni, tak pasti ke macam mana? Okay. So cara COVID-19 tersebar, dia tak boleh tersebar melalui sentuhan darah ataupun daripada literature tak ada evidence yang darah ni boleh menjadi ejen untuk menyebarkan COVID-19. Maksudnya bukan main mode of transmission. So the 3 main mode of transmission ramai yang jawab betul Alhamdulillah, because in order for you to determine what type of PPE that you use, you should be aware of how COVID-19 spread. From there, then you know what type of PPE you want to select and wear. Okay. Lagi, sikit lagi. Regardless of PPE that I'm wearing, it does not affect the risk of me getting infected with COVID-19. Zaan. Ini pun patutnya spinal reflex ni ya, jawab. Okey, jawapan dia adalah disagree. Yang agree ni mungkin baca soalan laju-laju ni. So the type of PPE that you wear determine the risk of you getting infected. So the better your protection, the lesser you get the chance to be infected with COVID-19. Okay, I do not regularly clean and disinfect the medical equipment. Stethoscope, glucometer, thermometer, before and or after use. Ini pun memerlukan kejujuran. Do you practice this one? Ramai yang disagree, so alhamdulillah majority buat. So yang agree dengan statement ni, alhamdulillah you all jujur. Tapi I hope this moment onward you all change and practice the best practice lah. So you should clean and disinfect all the medical equipment before or after use. So it's a good practice because you clean all the germs on top of the medical equipment to prevent its transmission. Bukan saja untuk COVID-19 but for the rest of the infectious disease. Sikit lagi. Ini cara pengurusan waste untuk pasien COVID-19. Sama ke tak dengan non-COVID? Okay. So pengurusan waste ni basically dia adalah sama je dengan patient yang lain yang non-COVID patient. Tak macam awal-awal pandemik hari tu you need to have a special pathway, special container. Cara pengurusannya adalah sama sahaja seperti pesakit-pesakit yang non-COVID. Okay, next question. Okay, a PUF patient under your care is planned for chest X-ray at radiology department. I am not obliged to notify the staff at radiology with regards to the patient infection status prior to transfer. The patient PUI nak transfer, tapi tak apalah, tak payah bagi tahu lah orang sebelah sana, hantar je. So, alhamdulillah ramai jawab disagree. This thing is not only apply for PUI patient. Kalau patient yang ada infection by MDRO, also the same thing apply. You are responsible to notify the receiving end because they need to prepare all the PPE, all the protection, all the measures they should prepare to limit the transmission at the transfer end. So we should be all responsible for that. Sikit lagi. Okay, I am fully vaccinated against COVID-19. Maksudnya I have been vaccinated fully. Dah dapat yang initial 2 dose. Tapi aspek ini 100% lah jawab ya. Jawab dah receive ya. Ada juga 2 non-vaccinated. Dr. harap yang 2 non-vaccinated ni mungkin boleh try to look for a vaccination because kita ni walaupun kita ni seorang manusia tapi kita tak sama dengan orang-orang di sekeliling kita yang berada di luar fasiliti kesihatan. Kita petugas kesihatan, the most sicker part of the population, penduduk komuniti akan datang kepada kita dan bawa macam-macam yang kita tak tahu termasuk COVID-19. So it is one of the way untuk kita menjaga diri kita sendiri jugalah. Dan bila kita jaga diri kita sendiri, kita juga jaga orang-orang tersayang kita. Kita tak transmit benda tu kepada orang yang tersayang, family members. Kita tak transmit the infection to the patient. So Dr. harap yang 2 ni turn yourself up for at least to get fully vaccinated if you are not getting any booster. At least vaccinated unless you have any contraindication to receive vaccine lah. Okay, do contact infection control if you need more guide. Okay, next one. Okay, this one yang dah dapat first booster. Tak semua jawab ya. First booster, okay, ada yang fully vaccinated tapi tak dapat booster kan? Okay, this one pun kalau you all nak dapat booster nanti doktor terangkan dekat doktor punya slides. So inilah soal vaksin. Second booster, berapa ramai yang dah dapat second booster? Okay, so 36 agree. Almost more than half yang belum dapat. Okay. Lagi sikit, 2 soalan lagi, last. Ini second last. I have not received any training on proper PPE donning endorphin while working in this hospital. So, ramai yang disagree. So, majority dah ada yang terima. Cuma yang belum menerima PPE donning endorphin punya ni, mungkin boleh inform site supervisor if at your area perlukan a formal training with regards to proper donning endorphin of PPE, boleh contact infection control ya. Ini untuk site supervisor untuk monitor jugalah. If anak buah perlu training, then boleh request dekat infection control. Nanti kita arrange. So, last question. Vaccinated healthcare workers still can be infected and at risk of transmitting the infection to the patient. This one pun along the way, kita punya presentation kita dah mention this one. Adakah yang vaccinated terdapat any privilege over yang unvaccinated healthcare worker in terms of pematuhan SOP? Okay, so can still be infected. Okay, so ramai yang agree, so alhamdulillah. Mungkin yang 4 ni boleh improve on your pemahaman lah. Okay, vaccinated healthcare workers still have the risk of transmitting if he or she get infected. Maksudnya vaksin tu is not 100% protective. Okay. Alamak, stop. Okay. Hello, you all boleh dengar ke?
Boleh doktor.
Boleh. Fadi, tolong share slide doktor. Laptop doktor hang pula. Doktor dah leave daripada laptop.
Okay, baik.
Masih baik share slide kat Fadi ya. Okay, untuk doktor punya slide, mainly untuk PPE, doktor boleh mention dekat sini yang in terms of mode of transmission of COVID-19, there's no changes. Apa yang kita tahu, itulah dia punya fakta. Transmission melalui exposure to droplets and contaminated surface. Jadinya, since mode of transmission ni tidak berubah, so maksudnya cara kita protect diri kita dari segi penggunaan PPE adalah sama lah. Next slide.
Okay, patient yang dekat now universal masking masih lagi is applicable in a healthcare area, meaning if you were in the hospital compound, you are required to wear your mask. And if you are berada di area counter, contohnya di counter farmasi ataupun di counter klinik, if the counter itself does not have a barrier, then you are required to pakai face shield lah at least. We recommended or we encourage pemakaian face shield still. Dan surgical face mask macam biasalah. And okay, this one di counter, non-clinical area, or even di klinik also the same thing applies. So untuk perawatan pesakit di ward yang tidak ada sebarang pesakit PUI ataupun pesakit COVID, kita still maintain dengan PPE level 1, which is level 1 kita yang wajib sekarang adalah apron dan face mask, surgical face mask. Untuk pemakaian face shield, again it is encouraged.
Ya, muted tu.
Hello?
Muted tadi.
Dengar? Setakat mana dengar tadi?
Sampai face shield.
Sampai face shield. Yang counter punya dah dengar?
Dengar doktor, sampai yang dekat non-COVID clinical area.
Non-COVID clinical area. Kita pakai, sebelum ni kita pakai PPE level 1. PPE level 1 kita consist of mask, face shield, glove dan plastic apron. Now kita dah reduce a little bit in which pemakaian glove, kita dah kurang emphasize on pemakaian glove. But instead of glove, you are still required to perform a strict hand hygiene lah. Pemakaian face shield masa manage patient, it is something that is recommended. But if you are not wearing, kita tak compromisekan you all. Dari segi emphasis pemakaian tu kita a little bit kurangkan. Tapi mask, face mask dengan plastic apron adalah wajib lah. Dan even the same thing is applied to contoh medical student or nursing student yang nak perform, yang nak approach or managing the patient, buat history taking ataupun examination ataupun buat any procedure to patient. Make sure perform hand hygiene. Tapi kalau tengok dekat yang doktor reflect dekat gambar ni, the nurses, dia punya handbag tak ada glove, and you should not have any accessories macam gelang ataupun watch, and it is also a good practice untuk tinggikan sikit lengan baju supaya the infectious or biohazardous fluid yang datang daripada pesakit tak terpercik dekat pemakaian kita. Okay. Practice ni agak kita expect this practice agak strict lah, especially di area-area critical, contohnya di NICU ataupun di ICU. So watch out your clothes ni daripada getting exposed to fluids from the patient, which is at risk of harboring infectious pathogen or germs. Next slide. Okay. So PUI COVID area dekat area ward, mortuary or COVID lab, yang seperti yang doktor tunjuk ni, preferably pakai, kita dah tak ada yang macam astronaut suit ni kan, so it is expected of you to wear a complete N95, pakai face shield, pakai long sleeve gown and glove. Okay, doktor ada include juga the one yang pakai plastic apron ni. Dia pakai plastic apron tapi dia pakai N95 with face shield. Ini kalau di KKM, in a way dia dah ada kelonggaran for those staff yang bekerja di area PUI ataupun COVID area, tapi they have no requirement untuk dia memegang patient, ataupun there is no physical contact dengan patient. So pemakaian seperti ni kita boleh benarkan, plastic apron, N95 dengan mask. Tapi if you are heavily involved in managing the patient, still recommended untuk pakai long sleeve gown ni. Untuk professional sample collection, untuk collection of PCR dengan RTK professional punya sample, still also a complete PPE lah. if you were to monitor another person to do a manual RTK saliva test, it is adequate for you to wear a face mask with face shield. Kalau kena monitor lah. Next slide. Okay, dekat waiting area dekat dalam klinik, masih diwajibkan untuk the patient yang menunggu tu kena pakai face mask. Alright. And kalau nak tengok kat sini, Dr. also include another picture of a person, healthcare worker pakai N95 mask with face shield. Ini bukan di dalam ward, tapi mungkin di area yang di luar ward, di klinik mungkin. Dia berada di PUI area tapi absolutely tak ada contact dengan patient. So this kind of PPE is also applicable. So you should know what type of activity that you are going to do with the patient. Kalau macam jauh, tak ada urusan apa-apa dengan patient tapi berada dalam area tu, of course you kena pakai N95. Okay, next slide. Okay, so yang ni sama dekat klinik. Okay, for transfer of sample to the lab, adequate untuk pakai face mask saja. Tapi kalau ada rasa berisiko untuk expose dengan all those fluid punya specimen, better pakai glove dengan apron jugalah. Kalau all the specimen is secured inside the container, tak ada risk of exposure, then pakai mask je cukup. Next. Okay, untuk healthcare worker, you are recommended untuk update you all punya COVID-19 vaccination. So you can get your booster dose as early as 3 to 6 months following previous dose. So jika you all dah fully vaccinated, for example bulan 11 tahun lepas, bulan 2, bulan 3 tahun ni dah boleh start ambil booster. So doktor include also there is a link untuk find a PPV nearest to our location. Kalau tak silap doktor dekat Kuantan ni just ada satu klinik lah dekat area bypass. Klinik Putra Medik kot. So you need to call the clinic and book your slot. So book now. For those healthcare worker yang bekerja dekat high risk area, please do get a booster vaccination. Next. Okay, menurut KKM COVID-19 IPC guideline, it is stated that if healthcare worker punya number is limited untuk manage the patient, a pregnant healthcare worker is allowed to take care of PUI or confirmed case. Tetapi dia kena fulfill the following criteria. Dia kena fully vaccinated, dia punya age of pregnancy is between 14 to 28 weeks, tak ada comorbidity, tak ada immunocompromise. Luar daripada kriteria ni tak boleh jaga. Next. Okay, untuk visitors masih status quo. Untuk PUI confirm case tak ada visitor. Visitor untuk yang non-COVID case masih sama. Next. Okay, untuk caretaker, Dr. Syakwa dah ada mention kriteria untuk caretaker. And untuk caretaker, untuk case PUI ataupun confirm case generally tak boleh ada caretaker except certain group of patient yang mana memerlukan assistance ataupun contohnya pediatric patient, patient yang memerlukan support yang lebih lah. This one kita boleh consider. And for those caretaker who had been allowed to take care of the patient, the responsibility falls on the nurses in charge and the site supervisor untuk monitor. You are responsible to orientate, educate the caretaker on hand hygiene, pemakaian PPE, kena pakai mask semua tu, proper cough acting, explain all the do's and don'ts, and should highlight to them, should not bergerak dengan banyak lah, keluar masuk bilik tu, semua tu tak boleh. Alright, so I think this is my last slide. Good. Next. Yes, okay. Alright. Okay, thank you. That's it. That's all for my part.
Jazakumullah khair kepada Dr. Hidayah for our last presentation for today. So as of now, kita ada any question from the participants? There's one in the chat box which I think Dr. Syakwa already presented dalam case study just now. And macam Syairah pun ada tanya berkenaan dengan isolation causing the room penuh, and quiz yang Dr. Hidayah mention pun open cubicle cohort boleh letak kalau kita untuk case PUI atau positif. And then for ada request lah untuk PDF, insyaAllah nanti kita share the PDF of the presentation with the our RAD our rapid assessment team punya group. Any more question from the participant? Tak ada soalan di YouTube live ataupun di chat box.
Padi,
Okay.
Dr. nak highlight kalau mana-mana kawasan ada concern berkaitan SOP, minta inform kepada wakil RED, dia boleh ajukan dekat dalam WhatsApp group. So any soalan berkaitan dengan SOP, kita entertain dekat WhatsApp group lah. So tak payahlah you all nak mencari-cari dekat mana nak call Fadi ke, nak call warga ke, macam tu. So kita make full use of RED punya Susmed punya team tu.
Okay, baik. Alright. If let's say kita dah tak ada soalan daripada group chat box kita dan juga daripada participant, so alhamdulillah, that's the end of our CME today, our online talk regarding the SOP. So any update SOP we will inform through the RED team. So any question also can be diajukanlah kepada wakil RED kita di setiap department dan kita akan cuba jawablah seboleh ke dalam group. Baik, thank you so much for all the participants, to our speakers. InsyaAllah kita improve and practice the new SOP that we already enforce in Susmed for our better care of the patient and also service. Alright, without further ado, kita tangguh dulu online talk kita pagi ni dengan tasbih farah dan surat. Assalamualaikum warahmatullahi wabarakatuh. Don't forget to fill up the the feedback form to get the CTD point. I already posted in the chat box. Alright, thank you. Assalamualaikum.